This is my presentation on teratogen's effects on fetal development. What is a teratogen? A teratogen is an agent or condition including viruses, drugs, and chemicals that can impair prenatal development. It can lead to birth defects or even death. A behavioral teratogen is agents and conditions that can harm the prenatal brain, impairing the future child's intellectual and emotional functioning. Some facts about teratogens. Even though they're harmful, they do not always cause damage, and some only cause damage during critical periods of fetal development. Another factor we must consider is the dose frequency of exposure to the teratogen. The third factor to consider is that genes influence the effects of teratogens. Some teratogens have a threshold effect that are virtually harmless until exposure reaches a certain level at which they cross the threshold, according to Berger. Some examples of teratogens are alcohol, rubella, lead, cigarettes, marijuana, pesticides, thalidomide, various drugs such as meth, crack cocaine, opioids, and bath salts, etc. Prenatal development. There's 3 stages. The germinal stage is 0 to 2 weeks, embryonic stage 3 to 8 weeks, and the fetal stage 9 weeks to birth. It is important to understand the 3 stages of prenatal development because, as mentioned previously, each teratogen affects the fetus differently during each stage. Brain development is at risk at all fetal periods from teratogens. However, the germinal and embryonic period are critical for body formation. Nicotine. Nicotine is a teratogen that is more harmful in the 3rd trimester. However, smoking is discouraged during any time of pregnancy as the nicotine easily crosses the placenta into the fetal bloodstream. In fact, a developing fetus is exposed to higher nicotine levels than is the smoking mother, as nicotine is concentrated in the fetal compartment, according to Holbrook, 2017. Nicotine causes ectopic pregnancies to be more common, birth weights to be lower. How Brooke describes it was determined that each pack of cigarettes smoked during pregnancy decreased birth weight by an average of 2.8 grams. It increases placental resistance to blood flow, impairs amino acid transport, increases the chances of oral facial clefts, hernias, increased risk of being overweight and obese, increased risk for heart defects, increased risk for sudden infant death syndrome, type 2 diabetes, limb reduction defects, early menses in women, gastritis, and anal artesia. Its respiratory effects is that it increases risks of developing upper respiratory tract infections, bronchitis, lower respiratory infections, pulmonary hypertension, comprised lung function, asthma. Holbrook states clinical studies have indicated that in utero exposure is at least as harmful, if not more so, to the developing respiratory system as is continued exposure to secondhand smoke after birth. Nicotine's neurological effects. It alters normal brain development, brain size, small head circumference at birth, cortical thinning, impaired verbal working memory. Studies that measured brain development with imaging in utero have shown head circumference was decreased by 0.13 millimeters a week maternal smoking, biparietal diameter by 0.04 millimeters a week of smoking. The width of the ventral atrium was decreased by 0.12 millimeters a week of smoking, and transcerebral diameter was decreased by 0.8 millimeters a week of smoking. Nicotine's neurodevelopment behavioral effects. It affects intelligence, academic performance. It can lead to ADHD, externalizing behaviors, and future substance abuse. Externalizing behavior refers to the oppositional, aggressive, and overactive behavior disturbances. Prenatal nicotine exposure has been associated in multiple studies to externalizing behaviors in both males and females. Alcohol's effects. Heavy drinking during pregnancy can lead to fetal alcohol syndrome, which, according to Berger, is defined as a syndrome that distorts the facial features of a child, especially the eyes, ears, and upper lips. Alcohol passes to the baby through the umbilical cord and can cause miscarriage and stillbirth. Alcohol effects can cause learning disabilities, low body weight, heart defects, visioning or hearing problems, intellectual disabilities, hyperactivity, and speech and language delays. Cannabis effects. There is a common myth that smoking cannabis during pregnancy is safer than other substances. However, research shows that, like any other drug, cannabis used during pregnancy can be harmful to the developing fetus. With cannabis becoming decriminalized, there is worry that there will be an increase in pregnant women using cannabis. It impacts fetal brain development, leads to hyperactivity, poor cognitive function, decrease in birth weight, and changes in dopaminergic receptors in children. According to the World Health Organization, cannabis is consumed by 147 million people, or nearly 2.5% of the global population. Approximately 46% of that is young adults, ages 13 to 34 years old, have used cannabis in their lifetime, and 2 to 3% of the population consumes cannabis daily. A recent survey has documented that approximately 4.9% of women of childbearing age regularly smoke cannabis. Based on a national pregnancy and health survey conducted by National Institute on Drugs, the prevalence and substance use patterns among women delivering live-born infants in the U.S. The self-reported cannabis use during pregnancy was 2.9%, compared with 0.9 to 1.1 for cocaine. And these are my references.